The roar of the massive oak tree in the hospital courtyard had reached a terrifying pitch. The storm was escalating its fury. Nurse Emily Carter and her colleague Laura were performing their final rounds during their Wednesday night shift, already on edge from the storm's growing intensity. Outside, the wind had been screaming for hours, rattling windows and triggering emergency alerts. "Emily, this storm's far worse than they forecasted," Laura said nervously, eyeing the shuttering windows. The Weather Service had issued a hurricane warning. "Are we thinking about evaluating the hospital?" While checking patient charts, Emily heard the groan of the oak's roots tearing from the earth, clumps of dirt pelting the windows. "Evacuation's not an option, Laura. We've got 12 critical patients." "Moving them isn't safe," she replied, her voice heavy with concern. A deafening crack split the air. The giant oak crashed onto the main power lines, hitting the ground with a bone-rattling thud. The hospital plunged into darkness. The backup generator sputtered, but the storm's damage overwhelmed it. Red emergency lights flickered sporadically. "Emily! Water's flooding the basement." "The electrical systems are down," Technician James shouted over the radio. But Emily was already moving. Crisis was her domain. Her stride shifted, her demeanor transformed, as if she'd become someone else entirely. Over the next 6 hours, everyone at St. Joseph's Hospital would discover who Nurse Emily Carter truly was. Some were scrubs, but she had honed her skills saving lives in disaster zones. Welcome to Hidden Heroes. Drop a comment with your city and hit subscribe to join us. Emily Carter was St. Joseph's Hospital's most dependable intensive care nurse. The 32-year-old brunette had worked there for 3 years, delivering flawless performance each shift, organizing equipment with precision, and syncing seamlessly with doctors. Her dark hair always tied back neatly, Emily balanced professionalism with compassion. Her green eyes tracked every procedure meticulously, her steady hands instilling confidence in critical moments. Emily's team included Chief Physician Dr. Harris, anesthesiologist Dr. Patel, and Assistant Nurse Laura Evans. Dr. Harris, a 50-year-old veteran with 20 years in emergency medicine, commanded respect. Dr. Patel, a detail-oriented 47-year-old, had administered anesthesia at St. Joseph's for 15 years. Emily's patient care went beyond standard protocols. While others followed routine, she arranged equipment with military precision, anticipating every scenario. "Where'd you learn to be so methodical?" colleagues asked. "Experience," Emily would reply curtly. Her equipment checks resembled battlefield prep, her emergency supplies organized like for a high-stakes mission. "We're nurses, Emily, not a crisis team," they tease. At 19, Emily had enlisted in the Army, joining its disaster medicine specialist program. After basic training, she excelled in an 18-month intensive course, medical intervention in disasters, saving lives with minimal resources, managing multiple patients under pressure. She graduated in the top 5%. Her training commander had said, "A disaster medicine specialist isn't just a medic. You make life or death calls. You keep patients alive when systems fail." Emily mastered interventions in outages, complex care with basic tools, and operations in natural disaster zones. Her first assignment was a hurricane-stricken hospital in Florida, rescuing patients in floodwaters. She once manually ventilated a patient for hours when their respirator failed. Her second mission was wildfire support in Oregon, treating smoke inhalation injuries. Her third, a classified operation post-hurricane in the Caribbean, involved medical support for special teams. Over 9 years, Emily completed 156 critical disaster operations. Why leave the Army for nursing? That was a tangled story. PTSD, civilian adjustment, and the weight of high-stakes work made her transition rocky. After her 2021 discharge, Emily used therapy and career counseling to pivot to civilian healthcare. Intensive care nursing was a natural fit. St. Joseph's hired her, unaware of her overqualifications, a nursing degree, 9 years of disaster medicine, and certifications. "I've always wanted to care for critical patients," she told the hiring board, and she meant it. Daily nursing was simpler than disaster work, but Emily approached every case like a disaster specialist. "How do you know procedures so well?" Laura asked. "Observation," Emily replied. "Every patient teaches you." By Wednesday evening, storm warnings gripped St. Joseph's. The ICU housed 12 critical patients. Emily and Dr. Harris began preparations at 1 p.m., testing generators, checking supplies, and securing flood barriers. By 6 p.m., the storm's ferocity surged. The most critical patient, 60-year-old Thomas Reed, relied on mechanical ventilation for respiratory failure. Without power, he'd die within 20 minutes. Emily and Laura had prepped for 8 grueling hours, tension etched on their faces. The storm's roar grew louder, and Emily's movements became sharper, more deliberate. "Emily, this is worse than predicted," Laura said, staring outside. Emily assessed the situation. The storm was dire, but 12 lives hung in the balance. "Laura, we'll manage this together," she said firmly. As the courtyard trees swayed violently, the electrical system flickered. "This is dangerous," Dr. Harris said, his voice tight. "The system's unreliable for 12 critical patients." The storm hit full force. Dr. Harris's experience shone, but his hands shook during the first outage. "Doctor, need a moment?" Emily asked. "No, the patients can't wait," he replied, resolute. By the second hour, the storm worsened. Wind speeds exceeded forecasts. Dr. Harris struggled to breathe, anxiety mounting. By the third hour, the crisis peaked. Thomas Reed's ventilator was faltering. "Emily, the electrical system's fragile," Dr. Harris said, clutching a report. "No mistakes." Then came the catastrophic crash. The oak tree fell, severing power lines. Darkness engulfed the hospital. The backup generator failed as flooding surged. "Power's out." Emily's voice rang through the halls. Dr. Harris ran in panic. 12 critical patients, no power. Laura screamed. "They'll die." Thomas Reed's ventilator stopped. His blood pressure plummeted. The other 11 patients faced similar threats. "The nearest evacuation team is 2 hours out," Dr. Harris said. "They can't wait." Emily's mind raced, calculating. Thomas had 15 minutes before his lungs failed. The others wouldn't survive without power. 12 lives were slipping away. Her 9 years of training kicked in. Prioritize. Act fast. Save everyone. Dr. Harris, start emergency triage. Laura, prep manual ventilation. "I'm initiating disaster protocol," Emily commanded. Dr. Harris stared, stunned. "Emily, you're a nurse." 12 patients, no power, I won't lose them," she cut in, her voice ironclad. She donned disaster gloves, her training taking over. This was multi-casualty management, saving multiple critical patients at once, honed in disaster zones. Harris, start manual triage. Laura, distribute ventilation equipment. "I'll coordinate," Emily ordered. Thomas Reed's oxygen levels were crashing, hypoxia loomed. Her hands steady, Emily began manual ventilation. Sergeant Emily Carter had emerged. "Thomas's saturation is dropping, 65, 60. Dr. Harris shouted. "I'm on it," Emily said, rhythmically ventilating Thomas. Meanwhile, Anna Bennett's heart monitor blared, her pacemaker failed in the outage. "Anna's in cardiac arrest." Laura cried. Her heart stopped. Emily, ventilating Thomas with one hand, rushed to Anna. "Laura, take Thomas's ventilation." "I'm starting CPR on Anna." It mirrored that night in the Caribbean, 12 patients, No power, minimal tools, all saved. Emily pressed Anna's chest, 1, 2, 3, while guiding Laura on Thomas. We're losing them, Dr. Harris yelled. Focus and help. Emily snapped. 15 minutes passed. Sweat soaked her, but she didn't falter. Thomas's saturation hit 40. Anna's heart was silent. It's too late, Dr. Harris said. Never, Emily growled, intensifying ventilation and CPR. Thomas, your son needs you, she urged. Anna, fight for your family. 20 minutes in, both patients grew paler. Dr. Harris leaned in. Emily, we might need to let them go. No, she roared. You tell their families they're gone. I won't. Tears streamed, but her hands kept moving. At 25 minutes, a hum echoed from the basement. Generator! James shouted. Lights flickered. Power crept back. Anna's pacemaker hummed, her heart restarting. Pulse! Emily cried. Thomas's ventilator whirred, his saturation climbing, 60, 70, 80, 90. His eyes fluttered. Water, he whispered. Anna murmured, my family. Both lived. 6 hours later, Emily had saved all 12 patients. The generator's timely restart saved Anna, and Thomas survived thanks to Emily's relentless ventilation. All patients stable, she said, peeling off her gloves, sweat and tears mingling, her eyes alight with triumph. Laura sobbed. Emily, how didn't you give up? Dr. Harris marveled. This is unprecedented. It was time to reveal her truth. I'm not just a nurse, Emily said. 9 years in the Army as a disaster medicine specialist, managing multiple patients, saving lives in crises. The next morning, St. Joseph's buzzed. Chief Physician Dr. Morgan called an emergency meeting. Emily, saving 12 patients with manual methods, that's extraordinary. You need to know who I am, she replied. She shared her past, 9 years of disaster medicine, multi-patient management, crisis leadership. Dr. Morgan was stunned. You're our greatest asset. Will you lead our disaster coordination? Emily paused. I belong in patient care. She remains a nurse at St. Joseph's. Thomas Reed and the others recovered fully. One day, hospital director Ms. Larson asked, Emily, do you regret leaving the Army? Watching her team save lives, Emily smiled. No. I saved lives in disaster zones for 9 years. Now I do it here. Same mission, different place. Emily's story is more than heroism, it's about disaster expertise finding purpose in civilian life, driven by an unyielding instinct to serve. Sometimes, the greatest disaster specialists were scrubs, saving lives in hospital halls. Share this story, subscribe, and let these legends live on. The nurse you meet next might be a hidden hero, their duty unchanged despite the uniform.